Yeah, I'm back to give what I think will be my final report on the bladder situation I had. I had my bladder removed on December the 12th. It's now the first day of March. I am considerably better, but I still have some problems that I didn't think I was going to have. If you can't hear this very well, it's because my voice is not returned to its original state. It's crackly. Sometimes it's pitched real high, and normally I have somewhat of a deep voice, a bass voice, but it's not returned. I'm not sure why. My home care nurse told me, she was here today, and she told me that they have a speech therapist. She's going to have her come by next week and check me out to see if it's something that's damaged in my throat or something else. We don't know what it is. I'm also still pretty tired all the time. I feel better, but I'm still don't have the energy I should have at this point, almost 3 months out. I still get winded quickly. Didn't have that problem before. I don't know if it's somehow related to my voice problem. I just don't know. But we're going to try to get to the bottom of it. The nurse thought maybe since my blood pressure is outstanding, we give credit of that because I quit smoking. It used to be 140/80. That was considered normal, and it's now 110/60, which is, to me, very low. She said it's very good. So we're hoping maybe I can quit taking my blood pressure medicine. We're going to check my blood pressure before I take my medicine and after I take my medicine to see if there's a difference caused by the medicine, and go from there. But other than that, everything's okay. I've slowly gotten used to peeing in a bag. There's nothing you can do about it, so you got to get used to it. It's not as bad as it sounds. It's an inconvenience more than anything. But see, there's my voice. But at least, see, it pops, it goes up and down. At least I'm alive, so I guess I shouldn't complain. I'll let you know once I find out more about this blood pressure and my voice and my breath, once I find out.
How about your appetite?
My appetite's back. Food tastes like food again, which is great because for a while nothing tasted like food. It tasted like cardboard. Now everything tastes like it's supposed to taste. Chicken tastes like chicken, and spaghetti tastes like spaghetti, and so forth.
How about your sleeping?
My sleeping's never been a problem. I sleep more than I've ever slept in my life. I go to bed every night, roughly 10 o'clock, and I get up roughly 8 o'clock the next morning.
Do you have any pain?
I have no pain. I've never had pain. That's the one good thing about all this. Surprisingly, I've never had pain. Now, right after surgery, I was on a lot of pain pill that made me just batshit crazy, but I was never in pain. And I haven't been in pain since I've gotten home from the hospital.
How about depression?
I was depressed for a while. I guess depression is the word. I was concerned that I would never get back to where I was, and it got to the point where I knew I needed some type of help. So the nurse and I talked, and she recommended that I take a mild sedative. So she called my primary doctor, Dr. Stewart, and then I went in to see him the next week, and we discussed it, and he agreed that it would probably be helpful for the time being to go on this sedative to get my spirits back, which has worked. I'm not grumpy anymore. I'm not snappy. I don't sit around and think about, am I going to die? Is this procedure going to ruin my life? Which in reality, all it did was save my life. And it's got some inconveniences that have come along with it that I've got to adjust to. It just takes time, I guess, to figure out everything. And I'm getting impatient. I want to go back to how I felt before. At least halfway as good. I don't expect to be 100%. I know it was a major thing that my body went through and is probably still trying to get fixed. It's considered major surgery, and it whooped my ass. I'm gonna be honest with you. And anybody that's gonna have it, I hope yours will be as good pain-wise, but I hope you recover quicker. Now, I'm 74. Let's say this. I was in the prime age for this to happen, as far as the cancer and the prostate. They went bad at the same time, I guess. But I was in that period of my life where it normally happens to men, especially those who smoke.
Are you crying? Your
No.
eyes are watery.
No, my eyes have been. It's my sinuses.
Okay.
I think they're really bad. Of course, right now the pollen's starting to fall and they're getting really bad. That's totally unrelated to the surgery that I had. I don't know why my sinuses gotten so bad.
How's your smoking?
Oh, I don't smoke. Don't want to smoke. I'll never smoke again. For anybody that does smoke, I know how hard it is to stop smoking. I smoked for 50 years, and I kept saying I needed to quit. But when you go through a surgery like I went through, and suddenly you're peeing out of your side, and you know it's because of smoking. If that doesn't give you a reason to quit, well, friend, you need to just keep on smoking and don't worry about it. That's all I can say. I'm not going to tell anybody what they should do, because I should have quit a long time ago.
So all in all, this has been a good part of your life, a good change for your life?
I don't know if it's a good change. It's good that I got cancer out of my body.
Mm-hmm.
That part's good.
Excuse me.
It's been a tremendous adjustment. I didn't know what to expect. I mean, nobody does until it happens. I mean, you think, well, I won't be peeing the same way I used to. It sounds kind of weird.
Well, that's a loss.
It's just an adjustment.
Mm.
And I mean, I know I've got it all figured out. My wife changes the bag for me every week, and I change it halfway through the week. I change the outside bag, so it's not a big deal. It just takes a little time. You got to be real careful and make sure you're clean, and you don't go past a week, because if you do, it'll start leaking. I had that happen to me 3 times, and it was my fault because I got my days confused as to when I was supposed to change it.
So you recommend picking a day of the week?
Yes, that's what we finally decided on. The last time I had a blowout, it was not in the bed, thankfully. I didn't have to change my bed. I was actually sitting right here, and I felt something, and I looked down and I could see urine coming out from under the bag. I was able to catch it before I got on the chair. So I took off all my clothes and went in the shower and got cleaned up, and then took off the old bag, and my wife got a new bag out, and we put it on, and that solved the problem. So do not go past 7 days, because the little adhesive stuff, for lack of a word, that goes on the back of this bag that sticks to your skin, after a week, I'm guessing it breaks down.
Yeah, it deteriorates.
And it loses its holding power, because on the side of the bag, and I'll show you, it's no big deal. On the side, it is taped like on a Band-Aid.
Mm-hmm.
This outside thing you see is like a Band-Aid. And then the bag where the actual urine goes in, it attaches to it. These little things right here, that's how you pull it off when you want to change that bag. And it pulls off like a top of a Tupperware. It's got a little rim all the way around it, and it just pops into place. And this has to be changed every 4 days, because you'll see all kind of stuff in there, and you wonder what in the hell. And the doctor told me it's perfectly normal. Don't worry about it. It's this white-looking stuff. It's something your body does that you don't see.
It's like saliva.
When you pee the regular way, it's broken down. You don't see it. That red thing you see right there, that is the actual, what they call a stoma. That's a part of my small intestines that was cut and attached just below my kidneys, where the urine goes into this over here, and then they run it under my stomach, and then it comes out, punch a hole in your belly, and this red thing pops out, and that is actually part of my small intestines.
How is it affected when you're taking a shower?
It doesn't hit it directly, because there's no feet. There's no nerve.
Oh.
I just kind of cover it with my hand while I'm washing around it.
Okay.
And I rotate hands as needed. But that red thing you see is actually was originally part of my small intestines.
No, it still is.
Well, it still is. It's not attached to my small intestines anymore. This piece is attached just below my kidneys. And the urine goes in it, and it comes down, and it's got a little hole in the tip, and urine you never feel it. I mean, it's not like that feels good. You don't feel anything. Just ever so often, I just pick up my shirt and check it. And when it gets like halfway full, you need to go dump it. And it's very easy. This little handle thing right here, I just turn it counterclockwise, and then this little top just comes off, and then the urine just comes out. I just sit on the toilet like I'm taking a poop, and hold it down between my legs and open it, and it just comes out.
Yeah.
Then you just put the top back on it and twist it back over to where it is now, and that closes it.
Really doesn't take any longer than when you were actually going to the bathroom.
Not really. It might take 5 seconds more at the most. There's nothing to it, really.
Okay, well, I'm sure glad that you came through this well, and sorry for some of the problems you've had, but all in all, it hasn't been as bad as you thought it was going to be?
No, it hasn't been bad as I thought it was. I was expecting to have a lot of pain and a lot of discomfort, and I don't have any of that, but I wasn't expecting to go through a phase of depression.
Yeah, well, that happens a lot.
Wondering what was going on and how long it was going to happen. Would I ever get back to normal, or is this my normal? And it's a slow process, much slower than I wanted, to get back to where I want to be. I'm not there yet. I've come a long way, but I've still got a ways to go.
Okay, well, I'm sure this has been real helpful to a lot of people, because you and I knew nothing about this when we went in, so that's good. All right, well, thank you, Mr. Manus.
Okay.
Bye-bye.
Bye.